Hello everyone, welcome. Today we'll be discussing on Debbie's story. All right, she's 27 years old and has had a ruptured ectopic pregnancy twice. Right now, the family would not be able to have conception naturally. They're currently saving money, and I know the case is around. Okay, we'll get into the story fully. So, welcome everyone. I want to know where you are joining in from. It's exciting. This is the fourth week on this episode. We've done the first week, second week, third week, and we've been discussing a whole lot of very important issues that affect women and children and families in general. Okay, so I want to know where you are joining in from. And also, if you have people that you invited to be on the call, this is the time to begin to share the link to them and send it out and let everyone join us right now. Today also, the Medical Women's Association of Nigeria begins their biannual conference, and there will be a swearing in on Wednesday for Dr. Zainab Kwaru Mohammed Idris, who is the person who wrote the foreword for My Family Companion, the book we are using to bring this episode of health to everyone across the world. Okay, it's an amazing time for them, and I want to use this opportunity to especially appreciate them for the partnership and what we have been doing across the 36 states of the country. And while I say that, I also want to use this venture to invite everyone who would like to volunteer. We want to translate this book into English. Sorry, it's already in English. We want to translate it to Yoruba, to Igbo, to Hausa, and to Pidgin. Not in written form, because oftentimes people who speak those languages may not be able to read those local languages. We are translating them to audio versions. All right, just so it will be able to benefit as many families as possible across the 36 states. So if you are watching this and you want to be a part of that, please indicate in the comment section or by sending a mail to the mail we're going to pin in the comment section. And just know there will be recognition for that globally coming to you from the Medical Women's Association of Nigeria and also from our own organization, Family Companion. All right, I want to say again, let me know where you are joining in from. I may not be able to recognize everyone as you are joining in, but just keep dropping your name and your location and invite as many persons as possible to join us. Invite them to join. So, as you know, everything we do, we always begin by sharing the story that inspired the topic. And we're taking Debbie's story. And as I always do in all the videos, if your name is Debbie, you're 27 years old, and you've had ectopic pregnancies in the past, this story is not about you. This story is real, yet it's been anonymized just to hide the identity of the person in question, but the clinical data has been maintained just so that the knowledge is communicated in the exact way that it happened, and we'll be able to deduce things from that and share with us on this platform. Okay? And meanwhile, my birthday is on the 30th of September. That's next month. And we have decided it's going to be the day that we officially launch My Family Companion. And it's going to be awesome. Okay? I'll have a YouTube live, and you're all invited to join to watch. All my friends, all my partners, will be given opportunity to speak on the platform. And on the 29th, before the 30th, I'll be premiering a video on the story of my life. All right, so I'm going to tell you guys all you need to know about Dr. Ovo, everything that's happened to me up until this point, my disappointments, my successes, the lessons I've learned, and most importantly, the stories that have been behind the scene. Okay, I'll just open my life like a book for you to read, and the video will be it will go live on the 29th, a day before my birthday. So on the birthday live, we'll have opportunity to ask questions and maybe ask me anything at all, and I'll try to answer. Okay, let's get straight to today's conversation. Okay, so this is Debbie's story. So my name is Debbie. I am 27 years old. I am fortunate to be married to a compassionate husband. Otherwise, my marriage could have been in rough waters by now. Though he is a quiet and a calm person, the truth is he's carrying a storm no one else can see. As for me, I've decided to stop blaming myself and heal, and his support has made it a lot easier. My recent pregnancy was my first as a married woman. It was supposed to be our joy, our beginning, but instead it brought us face to face with a past I thought I had buried. One I didn't have the courage to share with anyone, not even the man I married. When I was 17, I was raped and got pregnant. I didn't know. I was naive. I was too ashamed to talk to anyone about it. So it was a secret until one night, the pain on my right flank became unbearable. My parents rushed me to the hospital thinking it was appendicitis, but the doctors gave them a different diagnosis. I had a ruptured ectopic pregnancy, and the damage was severe. My right fallopian tube had to be removed completely. Years later, I got married. My husband once asked me about my scar. I told him it was from an appendix surgery, and he believed me. Fast forward to now, after we got married and I found out I was pregnant, I was so excited. We both were. I went to a government health center near our home. It wasn't a big place, but it was close by. They confirmed the pregnancy with a blood test, gave me a date, and told me to keep coming for checkups. And that was all. A few weeks in, I started feeling pain on my right side. On my left side, it wasn't too intense at first, just a dull ache on my flank. I went back to the health center a few times, but each time I was told the doctor wasn't around. The health attendant gave me paracetamol and said to me that it might just be early pregnancy cramps. By the 7th week, the pain had become sharp and unbearable. I collapsed at home and was rushed to a tertiary hospital in our town, and finally, I was seen by a doctor. I was resuscitated and stabilized. A bedside scan was done immediately. The result? Another ruptured ectopic pregnancy. The baby was lost. But the worst part, this time, the rupture was on my left fallopian tube. The damage was also so much that it had to be removed as well. And that was it. Both tubes gone. My husband sat in shock as the doctor explained our situation while I was in the recovery room. Then he slowly turned to me and asked, "But that scar, didn't you say it was appendix?" I couldn't speak. I just cried as the trauma of my teenage rape experience hit me once again. Now, our only option for carrying our own child is through IVF or similar procedures. Currently, we're working towards it, but it's expensive. But what hurts me the most is that all of this could have been avoided if I had gone to the right kind of hospital for my antenatal, and if the doctor had seen me from onset. I'm sharing my story to encourage and advise that if you're pregnant or you're planning to be pregnant someday, choose your antenatal care facility wisely. It's not just enough or just about confirming the pregnancy, it's about seeing a qualified doctor, getting a proper scan, and ruling out life-threatening conditions like ectopic pregnancy. Antenatal care is not something to cut corners on. And if you have a complicated medical past, even if it's something too painful to talk about, share it with your doctor. And in my case, talk with your partner. Secrets can delay or destroy the very help you need. So that is Deborah's story. And currently, this couple are working towards an IVF. And the funny thing about IVF is that there's no guarantee. No one will give you a guarantee. It's still a 50-50. It may work, it may not work. And it's also very expensive. In some hospitals in my city, it's as expensive as 10 million. And that's not for the entire coverage. that's just what you pay to make sure, for them to know that you are serious about this stuff. Then along the line, you have many other payments to make, drugs to get, and all of this stuff. And my wife and I, our first baby, it's a personal stuff, but we didn't have to spend any money beyond thousands. But now you have someone else who's trying to just get their first baby, and they're thinking of 10 million plus, and with no guarantees. And these are the issues, some of the issues, because there are numerous others, all right, that come from poor antenatal seeking behavior. Going to the wrong place, not knowing what the right place looks like. Like in her case, you could see she didn't go to a maternity home or go to a traditional birth attendant. She went to a government hospital, but it was also not the right place. And that's why we're going to look into this with the eye of a clinician and give you things you need to know, to look out for, to be sure that the place you are going to is actually the right place. Let's say you go to a private hospital, and then the person who is seeing you there is just a GP, a general practitioner. You're in the wrong place. It may be a big facility with beautiful technology, TV, and screens everywhere. But if an obstetrician and gynecologist is not seeing you, you are in danger. All right? And these are some of the issues. Okay? Yes, I'm a medical doctor, but let's say I'm working in a hospital, in a private hospital, and someone comes with a heart condition. I'm not a cardiologist. I'm not the best person to address that person's situation, but those are some of the things you see in some health settings. And just any doctor is a doctor, but that's not the case. We have specialists, and we have residency training that makes people to become specialists. So you have someone who has focused the last 10 years or 5 years or 7 years of his training after having graduated from medical school in a specialized unit to master a specific arm of health, because it's just so numerous, the issues that affect all of us. All right? Let's say that's by way of introduction. So in this episode, I'm going to be talking about antenatal care. What is antenatal care properly? All right? And how do you know the best places to register for an antenatal? All right? And what are the things that should happen there for you to know that this is actually the best place I'm supposed to be, regardless of the fancy facility or the poor appearance of the place? There are key things that makes the difference. All right? And then when is the best time to begin to go for antenatal? Like in the case of this lady. All right? If also she was someone who decided I'll start going for antenatal at my 3rd month, I'm an experienced mother, I've given birth to my 1st child, 2nd child, 3rd child, she may still end up in this situation because it's a factor of timing. So when is the best time, scientifically proven, for you to immediately register for antenatal for the best outcomes? Those are some of the things we'll look into. All right. So let's get into the conversation proper and many other stuff that we're going to look into. And then at the end of it, you drop your questions in the comment sections, and then I'll begin to attend to all of them. And also, if you don't belong to our community, we'll have a WhatsApp community where I am present. The Medical Women's Association of Nigeria is present, and we are there 247. Okay, sorry, not 247, 24, but not 7, because we'll have to sleep, right? So, but we are there to address any question and any concern that you have. I have several people in my DMs right now that we are trying to work up their situations. All right. And I know many of them are on the call. So, but like I shared with them, these are things that will make people know that these are real situations. I may share their stories from time to time, but not mention their names or their locations, but just so others are protected from getting into these circumstances. So, what exactly is antenatal care? All right. This is different from preconception care, which we talked about the last time. All right. This preconception is the care you receive before you become pregnant. All right. Natal talks about delivery. Antenatal is prenatal. So some people call it prenatal, some call it antenatal, but it's the same thing. So it is before natality, before delivery. So it means the woman is already pregnant and will begin to give the woman care. So all the care you receive from professionals from the moment you get pregnant up until we hear the baby cry, and you come out healthy and the baby comes out healthy, that is antenatal care. All right? Remember, I didn't just say the care you receive. I said the care you receive that guarantees that the baby comes out healthy and the mother comes out healthy. That is what we call antenatal care. Okay? So, through antenatal, you receive the right information for a healthy pregnancy. You also receive professional advice for safe delivery. You are taught all this. And the first delivery I participated in was traumatic. I almost wanted to vow that my wife wouldn't give birth by normal vaginal delivery, all right, because of the experience. So after that, I had to sit with the registrar who conducted the delivery and asked a lot of questions because the lady had a lot of tears and we were suturing, blood was just coming out and all of that. Why? Because she was rushed in emergency in labor, didn't receive any proper care or information on how to go through the labor process, and went into labor unprepared and was not following instructions and lacerated her body. It was so bad. So, and you received the professional advice on how you could go through your delivery and it to be safe for both you and the baby. All right. You also receive tips for caring for your baby. You be taught some of the basic things, how to lie your baby, because if you put your baby to sleep the wrong way, the baby could just die. I want to ask this question if you're on this call. What is the right way to put a baby to sleep? All right. If you've been in my meetings before, we have shared the answer. I don't want you to. All right. But let me ask you, is it on the back? Is it on the front? Maybe on the tummy? Or is it on the side? What is the best way to put a child to sleep? Put it in the comment section. I want to see that. And I'll make sure I come back to that before the call is over. But I just want to draw your attention to the percentage of people who have this information very, very wrong. Okay, well, in antenatal, you also get the opportunity for early detection and treatment of any potential health disease. If there's anything wrong in the child, it gives us the opportunity to see it early and arrest it. All right, and make sure that there's a best outcome for every single person. Okay, so let's go into the next concern, which I know is coming up in your heart. Where should you go for antenatal? All right, of course, in the hospital. There are many places people go for antenatal. People go for antenatal in some favor rooms. Some people go to some granny in the village. Some people go to some traditional birth attendant. They say this was a coach here. All right, that's how they say it in Igbo. It'd be like this, an experienced individual. All right, many of those things. But why this is very dangerous is because pregnancy, yes, is a normal, natural process, but it can quickly get complicated. All right. And science has helped us so much that we no longer enter that process blindly. Let's say the lady has an accompanying fibroid in the pregnancy, and let's say the pregnancy was able to thrive. All right. But now the positioning, we looked into this some time ago, and then I showed you how all of these things happened on the screen I shared, right? On the call we had with Dr. Digoma a couple of weeks ago. It was you remember that, right? So if that fibroid is positioned wrongly, it could make that pushing will not be possible. Those days, nobody would see that because it's all inside the woman. But right now, we're able to look inside and see. And not necessarily by going through her body, but just some scans show us everything happening inside in a very excellent way. So these are all the things that makes that going to the wrong place is very, 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 very unsafe for you. Okay? So when you go to the wrong place, a couple of things could happen among all the things I've talked about. Okay? Now, problems might be missed. Something may be going wrong and they may not be able to identify that because they don't have the knowledge and the technology to do that. All right? They may also give you the wrong advice. Many persons that have gone, they tell you, okay, when the child is born, rub Vaseline, it helps the umbilical cord to fall off very fast, or use hot water to be cleaning it, it helps it to fall off so fast. And those things look like common sense, but they are all wrong and they lead to children dying. In some of those places, they tell people that if the child's head has not closed by the first 1 year, they should come and let them rub some ash mixed with cow dung or some other funny things they do and now complicate the life of the child. So when you receive those wrong advice, in the background of it having worked for several other people, you notice it becomes something enshrined in the person's mind that reasonable science no longer makes sense. All right? Because somehow there's an evidence that this has worked for someone else. So those places could also have poor hygiene and lead to infections in the woman. All right. So important tests could be missed and so on and so forth. Okay. There's what we call focused antenatal care. I'm going somewhere. I want to make sure I build this excellently. And do I have an outline for you so I don't miss any of the stuff we do? When you go to the right place, all right, the first thing we try to achieve is what we call focused antenatal care. In focused antenatal care, it is a development by the WHO which tries to focus to see that it's not about you coming every time. We know you have a life, you have activities. Pregnancy is not all there is about your family at the time. So we structure it in a way that it is convenient for you and also safe for the baby. So within the first trimester, we give you appointment once every month, once every 4 weeks. By the time you get to the second trimester, we'll start giving you appointment once every 2 weeks. By the time you are now close to delivering your third trimester, your doctor wants to see you every single week. So you see the progress. The idea is to make sure it is convenient for you to comply with the care that we're offering to you. In some of those wrong places, they will not do it like this. So there are three kinds of hospitals generally around the world, okay? But specifically in Nigeria, we have the primary health centers. All right, we have the secondary health centers and we have the tertiary health centers. So the primary health centers are just those small clinics, often in communities close to people, and then you have basic things in place, but they don't handle complex cases. They don't handle surgeries. They don't handle any of those kind of stuff. All right, and the challenge with some of them is they can be poorly staffed and underfunded. So the doctor who is posted there may not be coming because he is not paid enough to cover even for the cost of his transport. So the motivation to come and do that work is not there. And if it's a place where there's no proper supervision, he may be receiving his salary, but he's not coming to work. Or he may be coming to work once a week. In the case of Deborah, which is what happened to her, she was told the doctor comes on Thursdays, but then when she comes, they said the doctor didn't come, all this kind of stuff. All right. So, and that's what makes that place not so good, except in some places where the primary health center is very functional, because the idea is that if you have a doctor who is in place, that is all you need. Why? Not because he's a magician, but because he understands his limits. Once he sees that what is going on is beyond my knowledge, which is rare, all right, because it has to be a specialist in that area, or will require more hands. Maybe I'll need an anesthesiologist. Maybe there's need for a surgery. And he knows I don't have the facility to carry out this care for this woman. He is very quick to refer to the right place at a proper time. All right. Then we'll have the secondary health centers, which is some of the private hospitals, all right, and some small general hospitals. Then we'll have the tertiary hospitals. These are the federal medical centers, the teaching hospitals, some very large general hospitals. There's let me not say this, but okay, very few private hospitals near this mark, right? In fact, I've not come across one yet. So this is a place where you have specialists in every unit of medicine that are present and are accessible 247, all right, with a team of doctors working under them so that nothing is missed. If the senior doctor misses it, the junior doctor won't miss it. If the junior doctor misses it, the most junior doctor won't miss it. So there's a chain of communication. So if the junior doctor does something, he has to report it upwards. If the senior doctor does something, he needs to teach it downwards. So that process of communication going up and down makes that it is difficult to miss any care that any woman needs. In fact, right now, across all tertiary hospitals in Nigeria, it is a crime for any woman who came for antenatal from beginning and followed up processes to have complication. In fact, they don't have it. In all my practice and all my placements in all tertiary hospitals, we have never had any complication for any woman who came to our hospital. The only complications we see are people who go to some other places and then when they are in complication, they are now rushed to us. But people who we attended to from the beginning to the end of the experience, they all have smooth experiences. All right. So where is the best among all these places I've mentioned? The best place is a place where you have a doctor who is seeing you. But let me give you these few tips, all right? So you understand it. How do you identify a very good place for your antenatal care? The first is that you need to know what a good care looks like. If you don't know what a good care looks like, you can't compare it and know whether something is actually going right or wrong. And that is what this session is about. I want you to know all you should expect so you know when you're not getting the right thing. That is the first and most important stuff. Number two, why this is important, you are your first line of defense. Not your doctor, not your mom, not your sister. You are the first care provider that you have with respect to pregnancy. So you must take that personal responsibility. Then the second thing I want to talk about is if you go to any place and you don't have access to a specialist, I didn't say to a doctor, I said to a specialist who is focused on seeing pregnant women. We'll call them obstetricians. All right. Sometimes here they'll call them ONG doctors, obstetrics and gynecology. Obstetrics is about health issues relating pregnancy and pregnant women, while gynecology is health issues, reproductive health issues affecting women in general. All right. So this is the difference. So the specialists in these places are always combined. So we'll call them obstetrician and a gynecologist, the same individual. Their training prepares them for everything reproductive health in pregnant women and non-pregnant women. All right. So if you are not seeing one every time you go to the hospital, I mean literally every time you go to the hospital, then something is wrong. All right, especially in our own setting in the world. It may be different in Canada, may be different in US, but I am talking about the developing countries in the world. All right, it is compulsory that you must see with your doctor at least for every time you visit for an appointment. All right. Okay, that's it. The next thing is if you go to any place and just somehow something feels off, maybe from the things, two issues I've raised already, all right? Maybe from the things I'm going to be teaching you and they're now talking about it, all right? Or you're not seeing a doctor, or just somehow you feel uncomfortable. You know, I'm one of those who believe that your spirit is your first instructor. So if you're already uncomfortable about the place in your spirit, there's need for you to have a second place. All right. And then by the time you balance the opinions you get from two places, you may see that you may come to some rest. Why? It's because if you don't trust your caregiver, you're already compromised. He may be the best, but if you really don't trust him or her, then the care they're giving to you, we are in doubt that you will be complying fully with it. And that is already as good as though you're not receiving any care at all. So that's why if you are already uncomfortable with the doctor who is seeing you, it is necessary you see with another doctor. In fact, you can even speak to the doctor and let the doctor know that, doctor, do you mind? I feel if you could refer me to another doctor, I feel quite uncomfortable. They won't be unhappy. Remember, it's your life. So speak up. Okay. So these are looking like very social issues, but these are real issues and very important. I don't want to create all the background stories that will bring them to light because it's going to be a lengthy conversation. We will not even scratch the surface of the key important things we are supposed to be talking about. Okay, so why is it, all right, that some people don't go to these places we recommend? Because my recommendation for you is go to a tertiary hospital, right? That's my recommendation, except you are able to find any other hospital where these two things I mentioned are in place. Good. Otherwise, go to a big tertiary hospital. And when I say that to women, oftentimes I get a lot of, doctor, and these are the issues, because I know there are questions in your heart already. Many persons think that that big hospital is expensive, but no, it is not. On the contrary, they're very affordable. I don't want to say this, but I just feel so much like saying it. All right. But I hear people say, okay, they gave birth their first baby, they spent 1 million, they spent this amount. And I'm like, are you serious? It's not like it's a whole lot of money, but you could get that same amount of care in a in other places. All right. Of course, if you could afford that, I mean, those are things you should give yourself the privilege to enjoy. All right. But child delivery shouldn't put you on your toes financially. Okay. So those very big tertiary hospitals, those federal medical centers, teaching hospital, general hospitals, they're so affordable. You won't believe it. They're so affordable. You just go there, you pay for a card for maybe 2,000 naira, which is less than $2, and then you just go see a doctor. And then they begin to see for your other appointment. I think sometimes it's 500 naira, which is less than maybe 50 cents, things like that. It's so cheap. And this applies to every developing countries. Why? Because all these countries are part of the WHO, and there's a need that they follow the WHO standard of incentivizing care, specifically in the area of maternal and child care. So whenever you see a big government hospital, go there. It's very cheap. It's being subsidized so much. So that's the first reason. Number two is that they tell you the wait time is so long. Let me remind you, when you go to the hospital, what do they call you? Remind me. Patient. So you need to be patient, my friend. All right? So you don't just walk in and walk out. So when you go there, be relaxed and enjoy the experience. Watch other people, ask questions, interact, learn. Okay? So, but let me also say this. As much as that is the understanding, I need to know that antenatal care is priority. In all hospitals, antenatal care happens every single day. Unlike, unlike other specialties, maybe cardiology clinic may be happening on Thursdays, but antenatal care clinics happen every day. And not just that, obstetric patients, meaning pregnant women, are the first to be seen before we begin to see gynecological cases. So when you come to a clinic to see an obstetrician and gynecologist, all the pregnant women come this side. That's it. Or it's digitalized. But the idea is that we give priority to pregnant cases first. So you bear that in mind. So don't think because it's big, plenty people will be there, I'll waste my time. No, it's also very fast. All right. The number three thing is that our labor ward and our theater for delivery is operational 24/7. There are 4 doctors on ground, a consultant, a senior registrar, a junior registrar, and a house officer consistently on that unit per time. In addition, you have midwives, you have nurses, you have the theater available with the anesthesiologist standby waiting to provide care. So do you see? No one should tell you otherwise. So make sure you go to that big hospital where plenty were waiting for you, okay? And then don't forget that also, even though we gave you appointments, we also tell you any day you feel uncomfortable, come. Whether your doctor is around or not, another obstetrician, consultant, and their registrars will see you and make sure you're taken care of. Okay? So that's that. The next complaint people have is that, hey, doctor, that hospital, everything is too far apart. You go to that place to pay for lab, you go to that place to collect the results, you climb the other place to do that. And I'll cover my face and say this one. It is true, yeah. And you know, the reason is because some of those hospitals from onset were not designed for what it is serving today. There were small mission hospitals in the past, small Catholic Church hospitals, small primary health centers, but as the community began to grow, it was expanded to accommodate more needs. And that's why sometimes it is not so properly structured. All right. And that's why when you're going for antenatal, you need to go with somebody. Your husband should go with you. All right. So that they learn what pregnancy is all about. That's very important. Okay. Except in circumstances where it's not possible. Let's say he lives far away from where you live here, or he traveled for another work or something or the other. But make sure you go with somebody, a relative, most importantly, your spouse. Okay, it's a bonding time for the entire family, especially for the guy or girl who is coming to join you. Okay, and then don't also remember that when it is inevitable that you must walk around, just in your mind, tell yourself, let me do a workout, because it's also good for your pregnancy. Okay, the next thing they complain about is that they tell you that the nurses are the health professionals are rude. That's so annoying. And yes, sometimes work can be so overwhelming, so overwhelming. When you see a doctor talking to you politely and so gently, I want you to know inside they just can't wait for you to go sometimes, because the work can just be so much. So my recommendation is for you to know that respect is reciprocal. So do the right things and address people politely, and they will also address you politely. But beyond that, most of these hospitals are beginning to put checks and balances in place. We'll have the Cervicom in all government hospitals to be sure that if you feel you've not been properly attended to, you can make a report and a complaint and put the name of the person or the unit you came to, and the hospital make sure it is addressed always. And that's the current practice in Nigeria. In some places, they even put CCTV cameras so that they monitor the behavior of the health workers. All right. And the final one, which is very, very concerning, is that many of the people say that they will force me to do a CS. All right. That's why I don't like going to the big hospitals. And this is where I want to say something. This sometimes is true, but not in the public hospitals, in the private hospitals. Sometimes once they just do it, book up for a CS because it's more expensive. But that's why I also tell you go to the government tertiary hospitals. Nobody even wants to do your CS when it is not necessary. But at the same time, nobody also doesn't want to do a CS when it is necessary for you. So you receive the best care. Scans are done, and when it is important that a CS, the doctor will tell you why. They won't just tell you, madam, you're doing a CS. No, they'll sit you down. They'll show you, do you see the scan? It shows your baby is this way and this and that makes that it is important we do this. Or woman, see your blood pressure and these are the parameters. If we continue and wait to this particular week, you may go into crisis. We may need to do an elective and bring out the baby before this advances. Or woman, a lot of stuff. You'll be told the reason. All right. So that's why you also need to go to those places. Okay. So, having said that, there are a couple of things I wanted to say, but okay, let me talk on some of the reasons why many persons are drawn to some of the wrong places. All right. Oftentimes they say it is cheaper. Maternity home is cheaper. That they are cheaper, but it's true. They can appear cheap, but sometimes cheap is expensive. I want you to imagine Debbie's case right now. Imagine it was a cheap place she went to. Let's say she went to a maternity home or a traditional birth attendant, and then she was receiving cheap care. All right, and now she have lost her 2 fallopian tubes. Pregnancy is costing like 10 million. It's now more expensive. So cheap can be expensive. When it comes to your care and your health, especially your pregnancy, that is not a place to cut corners. Every investment you make in time and in money is a right investment. Very important. All right. Now, sometimes people also tell you, I know other women who have delivered successfully there. And yes, it can be true. We're not in doubt of that. Pregnancy is a natural process. Some people even deliver at the back of their farms. But what about when complications set in? Oh, it's not my portion. No, it is not. Okay, tell me whose portion it is. So it's not about being careless with faith. It's about being practical with wisdom. Very important. So doing the right thing is the key. So other women have delivered it successfully. It's not you. Your case may be different. And some people may even tell you, I delivered 2 times there before. Yes, we have a case of a woman who had delivered 4 kids in a particular Mama Nkechi's clinic. All right. And then eventually her 5th one, she went to try it. She ran into complication, obstructed labor, was in labor for 2 days. And they kept telling her, don't worry, to come out. And she died. And the baby died also. Even if she was there for 7 years and pushing, it won't come out because it's obstructed. I'm getting so emotional about this. It's so annoying. We shouldn't do this way. It's when you look at the stories, that's so, I mean, it's completely avoidable. And when a person dies like this, especially for the kids, you don't know who the world lost. The genius who just missed by virtue of a parent's carelessness. That shouldn't be you, please. Okay? Dr. Ovo, calm down, calm down, calm down. All right. Okay. All right. You now hear some people say that that woman has gifted hands. Please leave her gifted hands and go to God, who has given us science. Okay? Because, like I said, pregnancy is a natural process until something goes wrong. And they will only share with you the good stories. Those bad ones that happen, they don't put it on their surface, they don't announce it. So please leave those places. All right? And what is shocking is that these things are not even only things that affect people you say they're not educated. No, we've seen very educated people fall victims to these same complications. So please, please, and please don't allow it to be you. All right. I don't know what we're discussing next week. Let me check. I think we're going to be discussing on labor proper. And I'll show you a story of someone, highly placed family. But now the woman died trying to deliver like the Hebrew women. All right. Okay, that's not the story. That's not what we're looking into next week. Okay. So it's still like up to 3 weeks ahead. All right. So, but that's very important. Don't be a victim of that. Okay. Now, some other persons will tell you that maternity home is more convenient and faster, and the people that are very kind. It's true. They're extremely, extremely, extremely very kind. We've seen a lot of them. Very nice people until they keep people. Don't go to those places. All right. So let me see what next we'll have to get into, because I want to make sure that we I don't want to miss any pin. All right. This I wrote all this in subheadings so we can have a very full conversation. Okay. All right. Also, let's talk about why some women don't register for antenatal at all or early. Let's look into that and look into them in both um, from the viewpoint that often inspires it. Yeah, so I'm sure we've talked about so much, but I still want to address this key issue, which is why some women, all right, delay going for antenatal or they don't even go at all. Some don't go at all. And this is not about people in rural areas. I'm talking about people in the cities. Some don't go for antenatal at all. Why some start very late? And these are some of the reasons and the dangers of each and every one of them. All right. Number one is some of them will tell you, my mother or my aunt will take care of me. They're experienced. Or they say that they know someone who can help me in XYZ. Or you hear things like, my mom is a midwife or my mom was a nurse. Some years ago, she was a nurse, but not necessarily that she's a professional nurse. But let's say she worked in some maternity home some years ago and just gathered some few skills. And right now, she is providing such care to her family. But those things are wrong, very wrong. The reason is because those dangers we've mentioned already that can affect women could step in and they will completely be blank. They won't have any insight as to what to do at all. So that's why you can't take that risk. Okay? Even your doctor doesn't just depend on himself alone. He has other people. Sometimes you go to a hospital and the doctor is seeing you and he tells you, hold on, and he calls someone else, maybe a senior or maybe his colleague. He says, look at this case. What do you think? He wants to get a second opinion. I mean, one of the things I've realized is that the more knowledgeable you become, the more humble you become. You are open to other people's opinion, other experts. And that's very important. The second reason why some people delay going for antenatal or don't go at all is that they tell you, I've been pregnant before. So I know all they'll give me. It's not folic acid with calcium, with vitamin, with this, with that. Is that not all they will do? But they forget that your first child can be rhesus negative and your second child can be rhesus positive, and your woman and you as a woman, you are rhesus negative. So every pregnancy is unique, is different. They forget that in the first pregnancy they may not have had issue with their blood pressure being high, but in this second pregnancy is different. It may come with some sugar issue, may come with some blood pressure issue or some protein in urine and all of those stuff. Okay. So each pregnancy is unique, so you can't depend on the experience of the previous one to provide care on the current one. In fact, just put it this way, the experiences are not transferable. Each one is unique. So don't allow yourself to have that mindset, whether in your first time pregnancy and maybe someone is around you telling you they already know what to expect or what you should expect. No. Even the doctors, when they see you, they're seeing you as a fresh pregnancy and they don't have to make a lot of references as to, okay, in your last pregnancy we did this, so in this one we'll do that. No. We'll have that at the back of our mind, but we're looking at what is before us. Very important. All right. Now, some people tell you, or this oftentimes is seen in the communities. All right. So some persons tell you, I want to deliver on my own, unassisted. It's a show of pride, a show of a kind of a badge of honor. But that labor is not a competition. All right. Even the Hebrew women who we referenced and want to deliver like, how did they deliver? They delivered under the care of professionals who then went and said to the king of Egypt, Pharaoh, that the Hebrew women deliver so fast. So the Hebrew women deliver under professional care. So deliver like a Hebrew woman and go to a doctor and see that an expert attends to you. Okay? And then finally, some person tell you, I will deliver at home because my mom is a midwife. Don't do that. I even know someone very close to me who did that. I was very, very, very unhappy with the person. What if, just what if, the bleeding doesn't stop? Delivery has happened normally. The baby is out already, but then bleeding just doesn't stop. Which can happen. It is the highest cause of maternal mortality worldwide, and Nigeria is leading. Where a woman just finished giving birth and the bleeding just would not stop. And we call it postpartum hemorrhage. It can be primary or secondary. Primary, the one that happens just immediately the woman is done delivering or within 24 hours. Or secondary, when it starts from day 2, day 3, or even day 4, when the woman is already at home. So you don't risk it. You don't risk it. It's not worth the risk at all. At all. All right? So if such a thing should start, what can your mom, who is a midwife, do? What can she do at that moment? Okay, it's not my portion. Whose portion is it? Okay? I'm sorry if I'm coming off as very mean today. It's maybe this is how I may be for the rest of the Zooms going forward, because we're getting to the real issues that really hurt families. And yeah, okay, so let's get to the right thing. We've stayed on the wrong things for so long. All right. When should you start antenatal? When? All right. The general principle is in the first trimester, which is within the first 12 weeks. But this is the clinical principle. Immediately you miss your period, go for antenatal. Let me read something for you. All right. I'm not going to mention the names, but just so you hear the story. Okay. Let me read one of the cases that is on my table right now. Give me a sec. Okay. Give me a sec. Okay. So this person says, I have an issue with pregnancy. I got pregnant without any knowledge that I was pregnant. I thought it was malaria and typhoid. So I took the drugs, but the symptoms kept showing up. I ignored it until I found out I haven't seen my period. I decided to do a pregnancy test and found out that I was 5 weeks and 4 days pregnant, meaning she did an ultrasound. And the fetus had issues. The doctor says the doctor said it could be due to the drug I took. All right. Now they're saying they can't find the growing fetus. And that I should come back for another test in 2 weeks. Or I could go for evacuation. Thursday makes it 2 weeks. Though I'm yet to visit the doctor. I don't know what to do. I'm just fed up and scared. Because since then, I've been experiencing serious pains on my tummy. And I can't even eat properly. The pain is just too much that I can't move at times. I mean, yeah. Real issues. Okay? So don't expose yourself to that. So that's why the moment you miss your period we've talked about the early pregnancy symptoms. If you've not watched those videos, go watch them. Arm yourself with those so you don't get pregnant and you're treating malaria. A couple lost twin pregnancy treating malaria. Now see her case, treating typhoid and malaria. Now, I've never asked what she took. Maybe she took some herbal concoctions, took ACT anti-malaria, got some injections. So the moment you miss your period, that is the time to immediately go see the doctor. All right? Don't wait till after 6 weeks. No, go immediately. Now, this is why timing is important. I'm going to give you a couple of reasons why going to antenatal early is very important. Number one, it helps us to confirm your pregnancy and estimate your due date early. Now, the ultrasound will use certain metrics in the ultrasound scan to establish how old that pregnancy is. But once that pregnancy begins to age, the ultrasound scan result becomes, the margin of error becomes wide. So we can no longer date properly. If you do a scan at 4 months, and that's the first scan you are doing, we can't establish your due date properly. And why is the due date important? Because with the due date, we will know when your baby have exceeded the time it should stay in the womb. Because some women will reach their term 37 completed weeks and the baby is not making any move. 38 weeks, 39 weeks, 40 weeks, 41 weeks, 42 weeks, 43 weeks. And a baby who has stayed this long, and maybe the result we have in our estimation for your due date, will still think you need 2 more weeks, whereas you are past by several weeks already. What happens? The baby dies inside the woman. Because there's a certain time it becomes the womb is no longer a conducive environment enough for the baby. So we need to time it properly. So if we don't get the timing properly, you can run into complications. Your baby also. Okay? So that is it. Number 2 reason is because we need to check and screen you for a lot of health and medical conditions. We need to check your blood pressure to be sure you don't have blood pressure in pregnancy, all right, that you brought into pregnancy, or you have diabetes you brought into pregnancy, or if the pregnancy have not initiated diabetes or even elevated your blood pressure. Because those things can make pregnancy very, very miserable, that you will vow you'll never be pregnant again. Someone is chatting me. Okay, I won't read this one. Tell me, doctor, I'm afraid of getting pregnant. In fact, that's why I've been turning down all kind of guys who have been asking me out, because I'm so scared of pregnancy. I asked, so why are you so afraid? She begins to share the story. This one of my sister was pregnant. She was in and out of hospital. At one time, she almost died. This one and that one. That. So all those stories have made her so afraid. Now, imagine if it was not just a story, that she actually had that experience in her first pregnancy. You can't tell her to get pregnant again. So when we check this, we did a video about it. So if you've not watched it, you go watch it. It's called preconception care. All right? So we look into those, and once we've established your health needs, we address them. And all that, your medical needs. Now, if you have some health complications, let's say you still have HIV, they may not know, or have diabetes, they may, or rather have hepatitis, they may not know. But when we find those out, we're able to initiate what we call prevention of mother-to-child transmission and protect the child. So this is part of the reason why it's important. But imagine if the person has not come early and those things have become complicated, the baby is already infected with the disease, it's done. You can't do anything at that point. All right? So other things we also do is to help us to determine pregnancy complications early. We'll do the ultrasound and we'll confirm that the baby is not really viable, or rather is not really properly developing. Then we'll advise the parent to evacuate the child and wait and conceive another baby. People who don't do that, by the time they're finding out they've spent 8 months in pregnancy, and that's when the doctor is seeing that this baby doesn't have one leg, or that the brain is just a skull, nothing inside. I'm just giving extreme illustrations, but yes, have complications that will make that the child cannot survive in the real life. All right, we're able to find those things out early if you come for early antenatal. Then this is also an opportunity for us to teach you early about your dieting, your routine drugs, the supplements you need to take. Some people give birth and then at the back here, it's open. Why? Simply because they're not getting the proper medications they need to be getting. So, a lot of issues. So you can see I'm very, very concerned about this, and I want you to really take it serious. Whether you're married or you're not married, please give yourself a chance and your child the best chance, please. All right. And that thing we do is that we get a glimpse of your baby. Let's see what that your baby looks like. We even know if it's a boy or a girl. We'll tell you. You will see it yourself also. Don't you want to experience that? Don't you want to show your child his first picture, an ultrasound that shows when he was just doing like this in the womb? Give your kids those memories. Technology has benefited us with that, so let's do that for them, okay? All right, so those are the reasons why you should get for your antenatal immediately miss your period. And don't forget your doctors will give you appointments properly in a way. So some may ask, what if I'm giving 4 weeks appointment, but then within that 4 weeks something has gone wrong? When we do the lab results, let's say we do a scan and the scan shows something wrong, that person who did the scan in the place that your doctor told you to go will immediately tell you, don't wait for your appointment, go and see your doctor immediately. Do you see that? If you did a lab test and then the lab test showed that your race is negative, that person will tell you, don't wait for your appointment, go and see your doctor even today immediately. So there's no window for anything to go wrong if you do the right thing. All right. Let's look into some warning signs you should not ignore during pregnancy. All right. There are a couple of them. I'll just list them one by one and then we jump off because there's still so much to talk about. All right, after we do that, we'll talk about, so what happens when you go for antenatal? Warning signs you should never overlook in pregnancy. In the first trimester, I'll list them one by one. Severe abdominal pain. In the first period, in the first trimester, 1 to 12 weeks, all right, it is not normal for you to be having pain as a pregnant woman. It's not normal. So when you see that, go and see a doctor. It may be a ectopic pregnancy, giving you a sign. The baby is planted in the wrong place. Let your doctor go see it. All right. So very important. It could be other things, but I just give you the one of the most frequent or common one. All right. So number 2, if you're having bleeding, you're pregnant and you're bleeding. Some people tell you that, doctor, can a woman who is pregnant be seeing her period? Where are you from, please? Huh? I said that so that we can all laugh, but like seriously, it doesn't happen. So if a woman, okay, it's a question on my screen here. But my sister was having her period when she was pregnant. I said, if your sister was having her period when she was pregnant, chances are high that that pregnancy, she did not carry it through. She later had miscarriage. She said, yes, but she was having her period during her pregnancy. I said, no, it wasn't period she was having. She was having bleeding. And because someone told her it is normal to be bleeding while pregnant, she considered it a period, whereas she was losing her baby little. That was a threatened miscarriage. And then eventually the baby was lost. She said, yes, that was what happened. I said, yes, why won't it happen? I mean, you don't depend on the things you read on the internet or what people say to you. You go see a doctor. Very important. All right. Now, it's wrong. In this first trimester, you're having excessive vomiting. Vomiting is normal. In pregnancy, spitting is normal, but you have excessive one. All right. It has become a problem because it could set you in a state where you have a lot of electrolyte imbalance in your blood. You're dehydrated, and it can also affect your baby. So it's wrong. If you see that, rush back to the hospital. If you have painful or bloody urination, you're urinating, it is painful, you're urinating, it is bloody, in your first trimester, go and see your doctor. First trimester, 1 to 12 weeks. Number 3, you are feeling faint, you are feeling dizzy, something is wrong, all right? You could have low blood pressure, you could have, low blood sugar, you could even be dehydrated, and all of these are very wrong for you and for your baby. In the second trimester, if you are having, again, pain in your tummy in the second trimester, it is not normal. It could be preterm level. Your doctor needs to see you and advise you and guide you. It could be placenta problems. We will have placenta abrasion, we will have placenta accrete, a lot of placenta issues that affect women. You want to go and see your doctor. If you're having severe headache in the second trimester, it is wrong. Or you're having blood vision, everything is looking not so clear, something is wrong. It could be that you have high blood pressure. That could lead to convulsion in some women. All right, you want to go and see to that. If you have swollen legs and swollen hands and swollen face in the second trimester, swollen legs especially, swollen hand that if you press it, it will deepen. If you remove your hand, the depth will still be there. You need to go and see a doctor. It's deep. There are people that if you do that, if you remove your hand, it goes up. But there are others that if you do it, if you remove your hand, it is still deep. Something is wrong, right? Now, you have temperature rising in the first trimester or second trimester, and you put your thermometer and you check, and it's above 38 degrees, 38.3 degrees, is wrong. Something is severely wrong. It could be malaria. Malaria makes pregnant. It can lead to miscarriage. It will lead to anemia. Make the baby to be small. Make the baby to come out preterm. A lot of things can go wrong. You need to go and see a doctor. All right. If you see you are urinating and it is painful, or you're urinating and there's blood in the second trimester, go and see your doctor. What's the second trimester? Second trimester is from 13 weeks to 26 weeks. First trimester from first week to 12 weeks. In the third trimester, all right, if you get into your third trimester and you begin to, they would have taught you the baby movement, and you begin to feel like your baby is no longer moving enough, all right. If you're a person who read the Bible, you could see that when Mary came to visit Elizabeth, she said the baby in my womb leaped. Once you get to trimester, when your baby moves, you will notice it, all right. So if you begin to notice they're no longer moving as often as possible, go and see a doctor. If you notice you are leaking fluid, this one is no longer blood, fluid is coming out in your third trimester, it is not normal, go and see a doctor. All right. If you're having severe abdominal pain, this is different from the cramps that comes with pregnancy. You're having severe that you can't just take it. It's not no, it is so painful you can't bear it. We used to say on a scale of 1 to 10, how painful is it? 1, you can bear it. 10, you want to die, right? Where is it? Once it's anything beyond 4, go and see a doctor. All right. So if you're in the third trimester and you're having shortness of breath, you climb up staircase, you can't breathe again, or you just take a walk, you can't breathe again, go and see a doctor. Okay. And so many other stuff, persistent headache, and so on and so forth. Okay. Let's move on because we've stayed so long on that. Okay. So now let's look into what happens during antenatal proper. When you get into antenatal visit, what should you expect? Number 1, you'll be given routine appointments. In the first trimester, you'll be given once every 4 weeks. And remember, it is a 12-week period. That means in that 12-week period, you're expected to have seen the doctor 3 times. Then you get to the second trimester, you're expected to see the doctor every 2 weeks. And finally, in your third trimester, from 27 weeks to 40 weeks, you're expected to see the doctor every single week until delivery. All right. And remember, when you come for this visit, you must come with a relative, your spouse preferably. And also, you also want to remember that whether or not it's your appointment, if something else is going off, you must come to the hospital and nobody will tell you it's not your day. Then number 2 is you'll be given routine drugs, right? So what are those routine drugs? You'll be given folic acid, you'll be given iron, you'll be given vitamin C, vitamin B complex, and calcium. These are some of the routine drugs they are given. In some places, you'll just be told to buy one pack they call pregnant care or something like that. All right. But now, some of the challenge with that is that some of them don't have calcium enough because they're made with Oyibo people in mind, people living outside the country in mind, and people living in some other places in mind. And in those places, their diary is high, so they get a lot of calcium from the milk and the dairy products they have. So sometimes in the the routine drugs they give them in one pack, you see if you check the calcium component, it's very absent, or it's absent, or it's very minimal. So if you are doing that, you also want to make sure you're buying calcium tablets separately. Always show your doctor and they will advise you. All right. In some other places, you may get vitamin D, omega-3 fatty acids, zinc, iodine, a lot of other stuff. But those first ones I mentioned are very routine. All right. So number 3 is when you go for antenatal, I'm telling you this so that these are things you expect. If you're not seeing them, something is wrong. You'll be taught about malaria prevention. They'll teach you and will prevent it by telling you how to make your home clean, putting nets in all your windows and all on your doors. But ultimately, will give you SP, sulfadiazine pyrimethamine, which is a prophylactic. Prophylaxis is like a drug will give you so that you will not get sick. But if you're sick already, a prophylactic drug cannot do anything. So those SP will give it at warm intervals in pregnancy to help women to prevent malaria in malaria endemic places like Nigeria and many parts of the developing countries in the world. All right, you need at least 3 doses throughout your pregnancy, minimum 3 doses. All right, and we'll give it 1 month apart. Okay, let's get to the fourth one. The fourth is that we'll do some tests that cannot be compromised. Number one, we'll do blood tests. In those blood tests, we'll check your blood group and your genotype. This is where we identify your rhesus status. This is also where we will know your blood, so that in case there's need for blood transfusion while you're pregnant, we don't need to be checking you at that time. We already know what it is. Number two, we'll check diseases like HIV, like hepatitis, like syphilis, and all of those diseases that can affect your baby, cytomegalovirus disease, and all of those things. We'll check all of them and we'll make sure you're in place. We'll also check for things like if you have your blood level, check your PCV to know if you are anemic and begin to advise you on your food you need to take. Also hematinic, which is drugs you also need to be taking to boost your blood, because it's very essential for your baby. If there's not sufficient blood, your baby will not receive enough food, enough oxygen, enough everything, and the baby will be lean, small, be exposed to challenges of preterm birth and also low birth weight, and that is a very bad way for a child to start life. All right. We also do urine tests. All right. We do a lot of tests with your urine. We do urinalysis, and we also do urine MCS to check for infections in your urine. Also check the character of your urine with urinalysis to check for protein and a lot of other stuff that we see, and it let us know what is going on in your entire renal system. All right. Because very important, because your renal system is functioning both for you and for your baby in pregnancy. So if it is compromised, baby is compromised. And ultimately, we do ultrasound. Very important. We do 3 compulsory ultrasound throughout pregnancy. I'm not saying that's the only thing done. We can do it every time you come to the hospital, but ideally, minimum in low resource settings where we don't have a lot of money and people can be able to afford all these things, basically, we'll make sure you receive at least 3. The first one you receive is to help us to understand where your baby is planted and also to date your pregnancy. Like I told you, the older the baby becomes in the womb, the less functional that scan is in giving these decisions. Number 2, we do the second one in your second trimester to help us to check if the baby is developing properly. We'll call it anomaly scan. And number 3, in the third trimester, we do to know how your baby is positioned, the size, to know what kind of delivery would your baby go through. Is it normal vaginal delivery, or do we do a CS for you? We also check other things like to see just your condition and preparedness for delivery. So it's very important. All right. In your pregnancy, we also give you tetanus injection. In your lifetime, you're supposed to get at least 5, and that covers you generally. So, but in each pregnancy, we'll try to give you at least 1. We'll try to give you like 2. But it depends on, there's a routine that it follows, which I don't want to like. We'll give the first one, all right, which is, we call it TT1, tetanus toxoid 1, all right. We wait and then we'll give the second one. So let me read it exactly as I have it here. When you get TT1, we'll give it as early as you get pregnant. As soon as you get pregnant, we'll give you your TT1, tetanus toxoid, first dose. Then 4 weeks later, we'll give you at least after 4 weeks, we'll give you, your tetanus toxoid 2, or at least 2 weeks before delivery. So if you had received the first dose in your first trimester, and maybe for some reason you didn't receive it, and you are close to delivery, we must give it to you at least 2 weeks before delivery. So that is it. So if they're not talking about tetanus toxoid where you're going for antenatal, you're in the wrong place. Then after that, in your next pregnancy, we'll give you again and again and again. But if you want, you may not even wait. 6 months after your TT, your second dose, you can take the third dose. All right. Then 1 year after the third dose, you can take the fourth dose. And 1 year after the 4th dose, you can take the 5th dose. So you see the pattern. So that way, you must not even be waiting for when I get pregnant, I'll take it. If you take it this way, you may see that within your first 6 years of being married and being pregnant for the first time, you've collected all the doses you need, and there's a cut for it. So your doctor will always ask you, looks at that before he recommends what needs to be done for you. So if they're not talking about this way you're going to, you're in the wrong place. In antenatal, we also talk about counseling. We'll tell you what to eat and what to avoid. We'll tell you how to sleep. Very important. Because some people lie on their back like this, and then they start complaining that they were having palpitations, or that they couldn't breathe properly. The reason, because when you're pregnant, the entire enlargement compresses on the very two large veins and arteries that is somehow just at the back of your, just inside, okay? I'm trying to look for the simplest words to explain it. Okay, so the pregnancy and your entire abdominal content compresses on that the veins and the artery, large vessels going up from the leg, taking every vein, collecting all the blood and sending it back to your heart. And then all the blood from the heart has pumped that needs to go down, passes through the one that is going down, which is the artery. When it compresses on those things, it could make that you begin to have some feeling that is funny. So the best way to just handle that is to lie by your left side. All right. So this becomes very important in the 3rd trimester, when the pregnancy has begun to actually get very, very, very big. All right. So these are the key issues we will tell you when you come for antenatal. And you will see that you have a very smooth experience. No issues, no worries, no trouble, and you have a smooth delivery. So, yeah, I know some of you will have maybe some questions, but I've tried to see that I look at it from all angles and address all the things that probably are questions in your heart already. But now is the time we're going to be taking questions in the comment section. Last week, we made an announcement for 2 persons who won the book from the questions that we asked. Unfortunately, okay, let me check. Give me a sec. Who were those individuals? Because I want to make the announcement right now. Okay, give me a sec. And then if you have questions, let's be taking them in the comment section right now, and I'll start addressing them almost immediately. Please hold on. Okay. 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 So our first correct answer came from David Otubo, who happens to be my brother, but it wasn't a complete answer. So the question was, tell us, as it was a, okay, let me remember, what was the question exactly? I've forgotten, but he gave an incomplete answer. He gave a correct answer, but he didn't give the follow-up questions that we asked. Let me remember exactly what was the question. Yes, we asked the question on BMI. And he got the correct answer, but he didn't say if it was overweight, underweight, or this and that. So the first complete correct answer is from Okoye Ifunanya Chukwu. So if you're on the call, Okoye Ifunanya Chukwu, I want you to drop send us a join our community, right? I'm going to be the link will be in the comment section right now. Join the community and indicate and identify yourself, so that we make sure you get a free copy of My Family Companion, which took me 2 years of intense work and back pain to write. All right. The second complete correct answer came from Victoria Nena. Congratulations to both of you. I'm so proud of you. Okay, so I'm going to go right now and look. I asked you a question earlier on what is the best position to put a child to sleep. What is the best position to put a child to sleep? Is it on the side? Is it on the front tummy? Or is it on the back? Okay, and the correct answer, all right, I don't know how to make the selection criteria right now, but the person who put the first correct answer in the chat room is the person that we're going to, okay, no. Everyone who put the correct answer, we're going to do a draw in next week edition. Make sure you're here. We're going to put all the names together, and then I'll do a draw, and I'll pick one person, and if that person is on the call, that person becomes the winner. Remember, if that person is on the call. So that's what we're going to be doing. Okay, so I want to say as I'm saying this, the window is still open. You can still answer, and I'll take you into the pool. So what's the correct position for putting a child to sleep? On the front, on the back, on the side? And the correct answer is not on the side. Yes, and the correct answer is not on the tummy or on the belly. The correct position is lying the child on the back. If you lie a child on their tummy or lie a child on their side, the child could sleep and just not wake up. We call it sudden infant death syndrome. Please don't make that mistake. Okay, I want to ask everyone who is on this call to like, subscribe, and share this video with at least 5 persons you know. Tell them, watch this video and learn. That's the best way you can support what I am doing here for women and families across the world. And I want that encouragement to come from you in particular, because it lets me know that you appreciate what I am doing. On Wednesday or on Tuesday, I'm going to be live again, teaching on something else unrelated to health. If you want to tune in, it's going to be a blessing to you. Also on Saturdays in the morning, I go live again and I teach on issues that affect people. So I'd like you to come join all the time. And also, every time you see Dr. Ovo video, make sure you are watching. I invite you right now, drop your questions in the comment section. Also join our community. I'm going live there in the community and also in the comment section to answer every bit of question that I see. And until I come your way next time, Dr. Ovo is here saying, have a happy life, give your best to knowledge acquiring, make sure every family around you knows the right thing they're doing, and let us make Nigeria safe and the world even a safer place. And until I come your way next time, Dr. Ovo here, and peace out.